So what can we do? Well, we have a very effective vaccine to prevent the infections that cause cervical cancer, as well as all the other 5 cancers that HPV causes in men and women. And in fact, we know the vaccine works well. I'm going to be showing you some of that data. And in the states that have the lower vaccine coverage, right here, you can see that the states with the lower vaccine coverage have the higher invasive cervical cancer incidence. And the states with the higher vaccine coverage have the lower cervical cancer incidence. So that leads us to say, we've got this powerful tool. We need to be using it. We have this tool, which is Gardasil 9, licensed here in the US and many other countries around the world, that protects against the 2 types that cause genital warts, as well as recurrent papillomatosis, respiratory papillomatosis, which is a rare condition of 2 to 4-year-old boys and girls and young adults in their 20s. It's horrible, requires multiple surgeries. The reason it's called recurrent papillomatosis is it continues to come back and require multiple surgeries in a year. And then we have protection against the 7 high-risk HPV types that we know cause cervical cancer, and 16 being the most important one for causing all of the other cancers, in addition to cervical cancer. So altogether, Gardasil 9 prevents around 90% of all HPV-related cancers, which is huge, just through vaccine. We know that the vaccine is safe. There are studies from more than 15 years. In fact, this year in 2026, we're celebrating 20 years of licensure of Gardasil, first introduced in the US market in the end of June. So unlike other live vaccines, Gardasil uses a virus-like particle as a major protein. So this is like an empty shell of a virus. So there is no infectious component to it. Over 100 million doses have been distributed in the US alone, and most countries in the world have been vaccinating. And the vaccine adverse events are monitored very carefully by the World Health Organization, by the Centers for Disease Control and Prevention, as well as by the regulatory agencies like the FDA and the regulatory agencies in multiple countries around the world. Every year, reports are written, and what we see is continued safety, and not only safety, but effectiveness in reducing the diseases that the vaccine was intended to reduce. These results have been published in multiple peer-reviewed journals, and right now, after more than 10 years of vaccinating millions of individuals, it does not seem that there's going to be a need for a booster. Now, are there side effects? Yes, you will hear both adolescent boys and girls saying, ouch, it hurts. So there's some mild pain and some mild redness and soreness, very similar to what you have with other vaccines that we routinely administer as school entry vaccines. It is very clear that the benefits of HPV vaccination far outweigh any of the potential side effects. Okay, well, who should get the HPV vaccine? Well, here in the United States, the vaccine is recommended for routine vaccination of both males and females in the age range 9 to 26. We tend to like to target the 11 and 12-year-olds because this is when they typically go for an adolescent health visit when they're getting their other vaccinations. So it's nice to bundle and package in that same visit the 3 vaccines that they need: Tdap, HPV vaccine, and the meningococcal vaccine. We also, in the United States, have a recommendation for both males and females ages 27 to 45 years of age with what we call a shared decision-making with their provider. So this is where the adult would have a discussion with their provider about their risk for HPV and their desire to receive vaccine. Health insurance covers the cost of the vaccine across the full age range 9 to 45. The doses are slightly different. If it's a younger person, ages 9 to 14, only 2 doses are needed. If they're ages 15 and older, then 3 doses are needed.